you had your surgery in 2011. Can you recap on what you felt or what happened to you when you felt your sternum go?
It sort of burned for quite a while after it give way,
Yeah. So how was that pain out of 10 when it happened?
I'd say about 8.
Were you getting any clicking or grating from that or discomfort?
You could feel movement there.
Yeah, we put the QualiBreath brace on you then. Did you get any immediate effect from that?
I felt support there straight away. I could lift things without the movement there. That really supported it.
1% of the people might have sternal complications of serious nature, which would involve that the bone not being properly united or having nasty infections. I would say up to 5% of the people would be unhappy with the way their sternum has been closed, and this is quite an underreported problem. So people don't usually go asking their patients, and hence we don't see that numbers. But if you do a survey and an audit, you'll find that quite a few people have those kind of problems. The main causes are advanced age, people who are overweight, and especially having respiratory problems and emphysema. There are also people who have got osteoporosis, so elderly ladies I think are quite prone for that. And people who have had past radiation or chemotherapy, it just makes their healing quite difficult, you see.
So Daryl's actually been open about 4 times already. So
given that his bone hasn't united so well, the question was as to how symptomatic he was. It wasn't that the pain was so excruciating that it was preventing him day-to-day work, but the sternum wasn't stable. On one side we had that he definitely needed something to be done, but if we would have thought of the surgical option, I thought he is 75. This would have been the 4th time, and that's not something pleasing for any patient to go under the knife once again. And after a second time sternal procedure, maybe still 50% of the patients aren't fully happy and won't get the same healing, you know. Because one thing which is underreported is, as well, the sternum heals very slowly, Daryl. It takes almost 2 years by the time 80% of the bone is united, you see. So, and in Daryl's case, we thought that he's better off taking a chance with conservative treatment, and hence we came up with the option which you guys have provided, and seems to be working well for him.
So ultrasound's just a way of imaging without any radiation, and it's non-invasive. So what I'm going to do is place this probe on, and it's going to give us a picture of your sternum, and we'll point out some features on that. We're using the gel so that the sound waves can actually go through. So you can actually see at this point, here we've got one edge of the bone and the other edge of the bone.
Right.
And because you've been wearing the brace for a period of time, the QualiBreath, and you've been minimising the amount of rotation and excessive pushing with one arm, and really following some of the precautions that the team set for you, that's given time for the connective tissue to actually fill the gap between the 2 bony edges. So can you see that railway track that's in between the 2 bones?
Yes, I can.
So that's formed a little joint, almost like silicone between the bones there, and it's formed a connection, and so that's part of the healing process. So wearing that brace has enabled the bony edges to just stay relatively still and allow that natural healing process to take place.
you've got a better quality of life out of the brace.